Good morning. My name is Joshua, and I'll be the nurse to carry out your postpartum assessment this morning. And I'll start off by asking you, how do you feel? Are you in any pain? Have you seen your baby? How is your baby doing? Is she feeling fine? Good. Now I'll go ahead and wash my hands, don my gloves, and at this point, I'm going to take your vital signs, and I'm going to check your BP, your pulse, your respiratory rate, and your um, temperature. And I expect everything to be within normal range. And at this point, I'm going to use my stethoscope to listen to your heart sound and lung sound, and I'm going to listen to the 5 points. I will start from the aortic valve, then I'll go to the pulmonic, I'll go to the tricuspid, and I will also go to the mitral, and at the same time I'm going to listen to your lung sound, and at this point I would also check the back, asking you to breathe in, deep breathe, and I can see that everything looks good. At this point, while I still have my stethoscope, I want to check your bowel sound. Now that we've not upsetted anything, I'm going to start from the right lower quadrant to right upper quadrant to left upper quadrant, and also to the left lower quadrant. And the bowel sounds is normal, and everything so far looks good. Then I'll also use this opportunity to check your CVA tenderness at the back. Here I'm going to use my hand, tap a little bit on both sides, and my question to you will be, did you feel any pain? And my client says no, that everything is good. Now, the next thing I'm going to do is do a head-to-toe assessment using the acronym BUBBLE. And the first letter there is B, which stands for the breast. In the breast, we are looking at the size, the color, whether both of them are symmetry or asymmetry. And we're also going to be feeling the breast, checking out for whether it's soft or whether it's engorged. We're also going to be looking at the nipple, and here we want to know whether there is any discharge, any cut, and we can see that everything looks normal. Then the next thing is the U, and here we are looking at the uterus, and we will be expecting to see the uterus at the midline, and we also expect, while we palpate, to see a firm uterus. Now we're going to use two hands, one at the lower side of the simple pubis, and we're also going to use this upper hand at the upper fundus. We're going to palpate, and I can see that the uterus is at the midline and is firm. Then the next thing we're going to look at will be the bladder. And for the bladder, while we're also looking at the uterus, we also discovered that the bladder wasn't extended or distended, sorry. And my question to my client, my patient would be, when was the last time you void? Do you need to void right now? Do you feel like? And she says no. So at this point, I'll go ahead to carry out the assessment, and we can see that the bladder is not distended and that everything looks good, because my patient already told me that she's not having any difficulty voiding. She doesn't have any burning sensation while she's voiding, which means there's no infection. And at this point, we can see that the bladder is not distended. Then the next thing we're going to look at is the bowel. We already checked the bowel at the earlier stage, going through the 4 quadrants, and then the bowel sound was okay. And the next thing will be the lochia. My patient is a 2-day old postpartum. I will be expecting to see a normal rubra, and I'll start by asking my patient about the amount of lochia and also the color and the odor. Then I will check. I can see that the amount is normal, the color is red, and that there is no odor, which is what we expect to see, which is a normal finding at this point. Then I'll go ahead to inspect the episiostomy at this point, because we need to look at it. I'll ask my patient to move to the side, and I'll use this flashlight, and here I will be looking out for any irritation. I'll be looking out for ecchymosis. I'll be looking out for tenderness or hematoma. I'm using the acronym reader to do this so that I will not forget anything. I'll also be looking out for edema, and I can see there is none, which gives me a normal finding at this point. Then I'll go ahead to look at the acronym H, which is the Hormone sign. For the hormone sign, we are looking out for any deep vein thrombosis, DVT, and also here we do that by feeling the 2 lower legs, and here we are going to feel for any tenderness, any heat, any edema, and I can see there's none. Then we're going to check for different reflexes. Here I'm going to carry the leg, dead weight of the leg, use a flex hammer, hit a little bit here, and you can see the reflex, which is +2. Then after that, I'll do maybe the same here, and it's also a +2. Then I'll go ahead to check for clonus, where I'm going to dorsiflex this foot, and I expect it to go normal, and you can see it went normal. The same thing here. If it were to be abnormal, it's going to go crack, 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 but we have a very normal clonus assessment here. The last one is the E for emotion. If you recall, when I came in, I had interaction with my patient where I asked about the baby, and her response shows me that she's more concerned about the baby than herself. So I can say that my client has a positive emotions about the newborn baby. So that would conclude my assessment, but let me look at my card to make sure that that I covered everything. Oh, I can see that I needed to check my client's skin. Now at the abdomen, I should be looking out for any stretch mark. You can see it's disappearing. I will also look at the what's it called? Let me look at it. I'll be looking out for the Niagara, and you can see it's disappearing as well. I will also look at the skin for any pregnancy mask, which is also disappearing at this point. Um, with all said and done, this is a very normal assessment that I found here today. There's no issues or complication, and that brings me to the end of my assessment. Thank you.